In this video we're going to look at some myofascial exercises to help with abdominal pain. In the absence of any underlying medical condition, abdominal pain is often due to fascial restrictions. These can form in the fascia that surrounds the whole cavity itself, or in the muscles, or in the viscera, which are the internal organs, all of which are wrapped in several layers of fascia. Fascial restrictions can happen, sometimes because of injury, quite often for a lot of people because of stress, and very commonly for people due to surgical procedures. These create scar tissue which over time can spread internally and sometimes form adhesions where one part of the abdominal cavity sticks onto something else. The muscles in the abdominal area are arranged in a crisscross pattern and they look a bit like the Union Jack. So the most superficial, the closest to the surface, is your rectus abdominis, which is the six-pack muscle that most people are familiar with. This runs horizontally from your rib cage down to your pubic bone. Underneath this, and arranged diagonally, so coming from the top down across the abdomen on both sides, are your obliques. And then underneath those are your transverse muscles, so the transversus it's called. Here's an image of all of these muscles so you can see how they're arranged. So when fascial restrictions develop, these can restrict the movement of the muscles and of the internal organs themselves, and this can create referred pain patterns. So we're going to do some exercises that can help to release some of these restrictions, and in doing so also help to undo some scar tissue if that has formed in your abdominal area. In this exercise we're going to do a stretch for our hip flexors, which are here in the front of our hips. They're important from an abdominal point of view because they extend from your lower leg up through your groin and into the abdominal area. So sometimes when they're tight, they can pull your body forwards and compress the abdominal cavity, which can affect how everything works. So by helping to stretch your hip flexors, you're helping to open out this whole area and create more space for all the structures contained within your abdomen. So the easiest way to do this stretch is on your bed at home. If you lie on the side of your bed and then just allow your leg to drop off the bed. So it doesn't matter whether your foot is touching the floor or not, as long as you allow your leg to go heavy, you'll start to feel a stretch here in the front of your hip. And as long as you're here for a couple of minutes, this will help to release the whole area here. And you sometimes will feel the stretch coming right the way up into your abdominal area. This stretch is particularly good for anybody who's got abdominal scar tissue because it helps to start stretch out the area. In this exercise we're going to use a myofascial ball to work on our hip flexor. So the hip flexors are found at the base of your abdominal area, just inside the hip bone. So if you feel for the pointy bit of bone, which is just about here, and then come inside a couple of inches, you're going to place the ball here. So I'd recommend not doing this directly after a heavy meal because it may feel a bit uncomfortable. So to do this, place the ball on your hip flexor and then just lie down on your front. You can do this on the floor or on your bed, but make sure that you feel comfortable and that you can just relax around the ball. And as long as you're here for at least a couple of minutes, the fascia and the muscles will start to release, and this will help to release fascial restrictions in your abdominal area, as well as allowing the hip flexors to let go. So you can do this exercise either one side at a time, or if you want to, you can work on both sides at the same time. In this exercise, we're going to do a spine twist. This is a lovely stretch for the whole of your abdominal pelvic area, as it stretches the muscles around the side of your hips. It stretches those oblique muscles that crisscross your abdomen, and also helps release any tension in your lower back, which sometimes can happen when you have abdominal pain. So sometimes you might need to have a prop such as this pillow, just to help make yourself comfortable in the stretch. So I'm going to lie on my back with my knees bent, and then I'm just going to drop my knees to one side. So allowing everything just to relax in this area, and just feel the sense of stretch happening. So you may feel the stretch more in your hip, or you might feel it more in your side. So wherever you're feeling it, it's fine for you. If, like me, your knees don't quite touch the floor, then you can use the pillow to support them. So here I can just allow my body to relax and have it supported. If you feel like you'd like to have a deeper stretch in this area, then you can just straighten your top leg. So again, if you find that your leg doesn't reach the floor or is not comfortable, you can place a pillow underneath it to support it. So as long as you're in the stretch for at least a couple of minutes, the fascia and the muscles in this whole spiral line round your body will start to release and let go. So this exercise, we're going to use two balls together in a bag to work on the back of our neck. So you may wonder why we'll be working the back of the neck in an abdominal exercise video. The reason for this is that there is a nerve called the vagus nerve, which starts in your brain and it travels throughout your body. It innervates your breathing, your heart, and most importantly, your digestion. Sometimes if your digestion has been a bit sluggish or you've been stressed, then it's not working properly, and it means that the vagus nerve has actually switched off. So one very easy way to help stimulate vagus nerve activity is by resting with some pressure on the back of your neck. And these balls are perfect for doing this. So you place the balls either side of your spinal column in your neck, and then just lie back on the balls. Just allowing time for your body to release and let go. So this exercise, you can be here anywhere from 2 to 5 minutes, and progressively you'll feel a softening and a sense of relaxation throughout your body. Sometimes when you're doing this exercise, your tummy might start to gurgle, in which case this is always a really good sign, because it means that your vagus nerve has been activated. So in this video, we've looked at some exercises which hopefully will help with any abdominal pain you might have, as it will relax this area and also help your whole body to relax and release. You can find more exercises like these in our online Living Pain Free program, which you can find on our website, along with our Living Pain Free myofascial release kits.